I'm interviewing Dr. Katie this afternoon. We'll be discussing the Emily program. Can you tell me about the Emily program?
Sure. We are located in Minnesota and Washington and Ohio and Pittsburgh now, and we treat eating disorders. And eating disorders happen for people from all ages, as little as 8, 9, 10 years old, up to people who are 65, 70. I've never personally worked with anyone over 66 years old, but the majority of our clients are really in their early 20s up to maybe 35, and then we have quite a few adolescents as well. And the eating disorders we treat are anorexia nervosa, bulimia nervosa, compulsive overeating, which is now classified as binge eating disorder, and then we have a whole bunch of people sort of in between that have kind of a mixture of those diagnoses. And lots of our clients have depression and anxiety, or they deal with substance use disorders, so addictions to alcohol or other drugs, along with their eating disorder. But pretty much everybody that we see is diagnosed with an eating disorder.
What is your job?
So I started out as a staff psychologist at the Emily program, so I'm a psychologist, and that means that I work with people, treating them with individual therapy. I do couples therapy, family therapy, and so part of my job is working with people, offering them therapy to help treat their eating disorder. And I'm also a clinical director at the Emily program, so that means that I help my colleagues who are also therapists and dietitians do their work. So we have a whole bunch, at the Emily program we have about 350 employees, and we have a whole bunch of therapists, a whole bunch of dietitians, a whole bunch of doctors that help people, and so I help manage and make sure everybody's doing what we need to be doing for the clients.
What does your average day look like?
So that's a good question. They're different. My average day would be that I would go in the morning at about 8 o'clock, and I see maybe 3 or 4 clients on a day for individual therapy, and sometimes I do a group. So group therapy is where I work with a group of about 8 patients, and they are all talking in a group about something that they're dealing with. So I'll see 3 or 4 clients, I'll do a group, and then I have some meetings typically that I need to do with my colleagues. I work with them to make sure they're able to get onto their computers and write their progress notes, because for every client we see we have to do documentation and have to write up a note after we see them. So I have to make sure that all of my colleagues are doing what we need to do to make sure our clients are being treated right.
Did anyone in your family have an eating disorder?
No one that I know of. I struggled with kind of what we call a sub-threshold eating disorder, which means what I struggled with myself wasn't actually bad enough to be diagnosed with an eating disorder, but what I struggled with was some bulimia. Again, it wasn't enough to actually be diagnosed as bulimia, but that I would overeat and then purge. And mostly it's because I had some depression, which means I was feeling badly about myself, and my mood was low, and that I would use that to help me cope. And I felt like I needed to have a really what we call it as body image issues, which I had a negative body image, so I didn't like my body, and so I was trying to do something to fix that. And I struggled on and off for about 4 years.
How did you get involved with the Emily program?
So when I got out of school, I wanted to work with clients every week. I wanted to see the same clients so I could help them over a longer period of time. So when I first got out of school, I worked at a hospital, and there I wasn't able to work with clients on a longer term basis. So a couple of my friends that I went to school with were working at the Emily program, and they told me that they were hiring, so I went to find out more about it. I did not know that I wanted to work with people with eating disorders, but once I got there, it was such a wonderful place to be and wonderful people to work with that I just knew I wanted to be there. So I started as an individual therapist and have been there for 9.5 years now.
What's the saddest thing you've ever seen?
The saddest thing I've ever seen is, and it's still the saddest, is that one of my clients died from an eating disorder. She had anorexia, and she was 30 years old, and she struggled since she was probably maybe 15, 16, and then it got really bad in her 20s, and she just couldn't get better from her eating disorder, and she ended up dying. And she had not only anorexia, but she was also very, very depressed. So that's to date, that was about 7 years ago, and to date, one of the hardest things I've ever went through. She was a wonderful, wonderful person.
What is the most rewarding?
Well, the most rewarding is working with all those people who actually do get better from their eating disorder, and that's the majority of people. So, though people with eating disorders do die, many actually get better and recover from eating disorders. So if I can play any part of that, in terms of helping them, that's the most rewarding thing. And I'm very lucky that I get to work with some people who are sick with their eating disorder, but they're really wonderful, amazing people who are gifted and they're kind and they're hopeful and they have joy. So part of my job is to sort of help them find happiness again in their life. And if I can help them do that, that's incredibly rewarding. I also really like the other rewarding part of my job is working with my colleagues, the people, the other therapists and the dietitians. It's really fun, challenging, rewarding work.
Thank you, Dr. Katie, for taking the time today to talk with me.
You're welcome, Sam. I'm so glad we were able to do this.
I've learned a lot about the Emily program.
Good. Thank you. Well, thanks for asking me. I'm glad we could do it.